Now, hospitals in some states are so overwhelmed with COVID cases that the military is being called in to help. At the request of FEMA, military medical personnel are now heading to New York and New Hampshire. 8 other states are already getting that assistance. NBC News global security reporter Dan Luce joins me now. Dan, good morning. So we're seeing these shortages of hospital workers across the country because they're either out sick with COVID, like so many people are from their jobs right now, or they're even leaving the field altogether because of this burnout they've experienced for nearly 2 years now. Tell us about this new deployment of military personnel to New York and New Hampshire and what's going on in those 8 other states.
That's right. You heard about the tremendous pressure on hospitals, on hospital staffs. And so the military has learned that an effective way that can help is to send these small teams of nurses, doctors, and paramedics to try to shore up the gap in the manpower shortage. And so what you have is the small team going to Buffalo and New York. You have another team going to Manchester, New Hampshire to help a hospital there. And they've already deployed teams across the country in 19 states. They have plans to send teams to another 10 states, including New York and New Hampshire. So this is the Pentagon's way of trying to stave off this tremendous pressure on the hospitals that are just finding, as you said, a lot of their own healthcare workers are out having to quarantine. And so they're really just facing this manpower problem. The other thing is that some states are mobilizing the National Guard also to try to make up the gap.
Now, Dan, what's this like when these military members join this fight? I mean, on that graphic there, we could see there's a 20-person team being deployed to Buffalo, New York, 15-person team being deployed to New Hampshire. What are they trained in? What kind of specific help are these military members providing here? I mean, are they used to being in this hospital environment?
These are very trained medical personnel, really experienced, seasoned professionals that are coming in. So think of it as a small cavalry arriving at the door when you're so shorthanded at a lot of these hospitals. So these are full-fledged doctors, very experienced nurses, paramedics, and other specialists that can literally just step right in, hit the ground running, no training required, know exactly what's required, including in an ICU situation, to help the hospitals cope with this influx of patients and the staffing shortage. So it's really a kind of a hidden military asset that a lot of people don't think of. And the military has been helping, of course, throughout the pandemic. And this is just another example.
Absolutely. Dan Luce, thank you so much for joining us to talk through this morning.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.